The coronary arteries branch out from A. Arch of aorta, B. Ascending aorta, C. Root of aorta, D. Descending aorta. And the answer is C. Root of aorta. Which of the following vessels is pulseless? A. Lymph vessel, B. Axillary vein, C. Femoral vein, D. Saphenous vein. And the answer is B. Axillary vein. Clotting of blood takes place due to A. Fibrinogen, B. Albumin, C. Globulin, D. Antibody. And the answer is A. Fibrinogen. Viscosity of blood is mainly due to A. Leukocytes, B. Erythrocytes, C. Thrombocytes, D. Minerals. And the answer is B. Erythrocytes. The normal range of blood pH is A. 7.15 to 7.35, B. 7.25 to 7.85, C. 7.35 to 7.45, D. 7.35 to 7.40. And the answer is C. 7.35 to 7.45. Of extracellular fluid is about A. 7.4, B. 6, C. 7, D. 5. And the answer is A. 7.4. Heart is situated in A. Cranial cavity, B. Thoracic cavity, C. Abdominal cavity, D. Pelvic cavity. And the answer is B. Thoracic cavity. Blood serum contains A. Antibodies, B. Plasma proteins, C. Ions, D. All of the above. And the answer is B. Plasma proteins. Erythropoiesis is controlled by the hormone A. Insulin, B. Erythropoietin, C. Glucagon, D. Estrogen. And the answer is B. Erythropoietin. The lifespan of mature RBC is A. 100 days, B. 130 days, C. 115 days, D. 120 days. And the answer is D. 120 days. Normal heart rate in an adult at rest A. 110, B. 125, C. 60, D. 72. And the answer is D. 72. Maker of heart is A. AV node, B. SA node, C. Bundle of hairs, D. Ventricle muscles. And the answer is B. SA node. Mitral valve is present between A. Right atrium and left ventricle, B. Right and left ventricle, C. Left ventricle and left atrium, D. Left ventricle and aorta. And the answer is C. Left ventricle and left atrium. Blood pressure is the pressure exerted by blood against A. Kidneys, B. Artery wall, C. Brain, D. Stomach. And the answer is B. Artery walls. The space where heart is situated is called A. Intercostal space, B. Abdomen, C. Pleura, D. Mediastinum. And the answer is D. Mediastinum. What is heart made of? A. Skin, B. Muscles, C. Bones, D. Tissues. And the answer is B. Muscles. The duration of cardiac cycle A. 0.008 second, B. 0.5 second, C. 0.8 second, D. 8 second. And the answer is C. 0.8 second. A heart murmur indicates a defective A assay node, B heart valve, C bundle of His, D AV node. And the answer is B heart valves. Average weight of heart is A 400 to 500 gram, B 200 to 400 gram, C 250 to 350 gram, D 500 to 600 gram. And the answer is C 250 to 350 gram. The blood drains to left chamber of heart from A. Pulmonary artery, B. Pulmonary vein, C. Coronary artery, D. None of the above. And the answer is B. Pulmonary vein. The deoxygenated blood collects first in which chamber of heart? A. Right ventricle, B. Left ventricle, C. Right atrium, D. Left atrium. And the answer is C. Right atrium. Oxygenated blood collects first in which chamber of heart? A. Right ventricle, B. Left ventricle, C. Right atrium, D. Left atrium. And the answer is D. Left atrium. Which organ failure causes bilateral leg swelling? A. Kidneys, B. Liver, C. Heart, D. Lungs. And the answer is heart. The gas that binds most strongly with hemoglobin is A. Oxygen, B. Carbon dioxide, C. Nitrogen, D. Carbon monoxide. And the answer is D. Carbon monoxide. The vitamin essential for clotting of blood is A. Vitamin A, B. Vitamin B, C. Vitamin C, D. Vitamin K. And the answer is D. Vitamin K. Which of the following has the thickest wall? A. Right ventricle, B. Left ventricle, C. Right atrium, D. Left atrium. And the answer is B. Left ventricle. Which artery is used for measuring blood pressure? A. Axillary artery, B. Brachial artery, C. Radial artery, D. Ulnar artery. And the answer is brachial artery. Superior vena cava and inferior vena cava drains blood in A. Left atrium, B. Left ventricle, C. Right ventricle, D. Right atrium. And the answer is D. Right atrium. How many valves are there in heart? A3, B4, C5, D6. And the answer is O. Dominant artery supply of heart by A. Left coronary artery, B. Right coronary artery, C. Left circumflex artery, D. Both A and B. And the answer is B. Right coronary artery.